So the question is, why is pain management and spine surgery all in one group? And it's really about the continuity of care as well as the continuum of care. Most patients, when they have a spinal issue, most patients just need to see an interventional pain specialist. They need some medications or some type of injection, physical therapy. And unfortunately, there are some patients, not all patients, but there are some patients that do need to go on to that, to have surgery, some type of surgical intervention that will help alleviate their pain symptoms. And having a team where we can figure out what's best suited for each patient, having that conversation with pain management specialists, physical therapists, and spine surgeons about what's most suited for patients is really to the patient's benefit, because then they're being matched with the right field of medicine that they need to engage with so that they're feeling much better. I think that during your medical education, especially in medical school, you get a very generalistic education. And a lot of the primary care doctors, they're dealing with so many issues with patients, from high blood pressure, high cholesterol, diabetes, strokes, coronary artery disease, that I feel like musculoskeletal care really gets pushed to the back. And a lot of them don't really get really well equipped to how to approach those things. Over the last 30 or 40 years, we've had an opioid crisis in the United States, where the most common way that people got introduced to those substances was from a primary care doctor. And up until maybe 10 years ago, so many primary care doctors, when they would get calls from their patient, I'm in pain, here's an opioid medication. Well, that's really not the first medication that you should be prescribing them. You should really be telling people, first start with Tylenol. If that doesn't work, you move into an anti-inflammatory drug like Motrin or Advil. And telling patients, you need to move around. Don't just lay in bed. You go back to the 1980s, they would tell people routinely, your back is hurting, lay in bed, take it easy for 3 or 4 days. But now we know every day you lay in your bed, you lose 3% of your muscle mass. So the next day you're down to 97%. Now you're losing another 3%. That takes you down to about 95% of your muscle mass. So you do that for 3-4 days, and before you know it, you're down to like 90% of your muscle mass in a very short amount of time. So now you're feeling the fatigue of losing muscle mass. Your problem is still there because you're not moving around, you're not increasing the blood flow. Your blood flow to any part of your body is what heals yourself. And when you come to a practice like us, we know the continuum of care, and it is a continuum of care, from starting from simple things like medications, moving it up to interventional pain management, which what I do majority of the time. And if need be, then we move it on to spine surgery if that's really necessary. And that continuum of care has really become the gold standard in the United States for how we approach musculoskeletal, in particular, spinal issues. I think you have a group of doctors here that actually really care about the patient, about putting the patient first, about doing what's right for the patient instead of what's right for us. When you always put the patient first, that's the best care ever, because you're doing what's right for them. The best advice I ever got was from another spine surgeon, probably when I was about 20 years old. And this is before I was in medical school, I was in college. And he told me, he said, no matter whatever happens in your life, as a doctor, always put the patient first. And if you put the patient first and you do the right thing that it's for them, you're gonna have 1 million patients. And it doesn't matter what happens with reimbursement or any of the government programs or the health insurance companies. Patients are always gonna need care. And if they know they come to a place where they are put first, they will keep coming back day and after day. And I've done that my entire career, and I think it's worked out pretty well.